Today, I was casually talking to a friend of mine and I mentioned this word glaucoma, and he was like, glaucoma? What is glaucoma? Now, it is just not his situation, but there are so many of us who do not know what is glaucoma with respect to the eyes. Glaucoma is a very serious disease of the eyes wherein there is damage of the optic nerve happening because of increased intraocular pressures. Now, what is intraocular pressure, you may ask me? Just like how there is blood flowing in our body which exerts some pressure on the blood vessels and we call it as blood pressure, there is also some fluid circulating within our eyes, and that fluid exerts a pressure on the coats of the eyeball, and that is called as intraocular pressure. Just like how a normal BP has been identified, say 120 by 80 millimeters of mercury, similarly there is a normal range of intraocular pressure which is about 14 to 21 millimeters of mercury. If there is a higher pressure more than 21 millimeters of mercury, then this kind of a pressure exerts pressure on the optic nerve and causes damage of the optic nerve fibers from outside inwards. So, what are the different type of glaucomas that we know of? Now, the high intraocular pressure could be because of excess of fluids being secreted within the eye, or if there is any impediment for the outflow of or the circulation of the fluid. The kind of glaucoma which happens because of excess of fluid production is known as open angle glaucoma. The kind of glaucoma which is identified because of impediment in the circulation of the fluid is known as narrow angle glaucoma. Apart from this, there can be a mixed variety as well. There is one more entity known as normotension glaucoma, wherein the pressure is within millimeters, 21 millimeters of mercury, but still there is some damage of the optic nerve. Some other variants are neonatal and congenital glaucomas, which are happening in the younger age group, and also secondary glaucomas which are not in the category of primary, but they are happening because of a pre-existing disease of the eye. Now, leaving aside the different kinds of glaucoma, you might ask me, is there a way I will know, doctor, that I have glaucoma? Unfortunately, there are no very clear symptoms that glaucoma comes with. One can have vague headaches, one can have frequent change of spectacle power, one can have difficulty in driving in night vision, one can see glares and halos around bulbs or the diyas that you light. Some people might experience that when they are driving, they are able to see straight, but if there is some other vehicle coming on the side, or if there is a street dog which passes by the side, they are not able to sense that. So these are all very vague kind of symptoms that can come with glaucoma, and sometimes there can be no symptoms at all. And that is why it becomes very important that you keep doing your annual eye checkups, wherein the doctor gets a chance to see whether there are any signs of glaucoma in you. Why do people get glaucoma, you might ask me? Now, just like how diabetes or hypertension can come because of a family history or can come just like that without anybody in your family suffering, similarly, even glaucoma has a higher tendency to occur in people who have a family history of glaucoma, but can still come on its own without anybody else in the family having suffered from it. If you are hypertensive, if you are diabetic, then there are higher chances that you may get glaucoma.